Hi, I'd like to thank everybody for joining us here today. We are very excited to share this information with you. Again, I am Stephanie Morello, the Communications Director with United We. Before we get started, I am going to ask that everybody please mute their microphones so everyone else is able to hear during the presentation. Again, I will be recording today's press conference and it will be available to you and anybody who is unable to join. And then lastly, we will have a Q&A at the conclusion of the presentation. So please feel free to type your questions into the chat box and we will get to as many as we can. And then we will also be able to unmute microphones later if you would like to ask your question verbally. All right, let's make sure we don't have any other people waiting here. Okay. I would like to introduce our speakers. Today we have Wendy Doyle, President and CEO of United We. We have Mark Meads, President of the Ash Grove Charitable Foundation. Dr. Ken Eastman, Dean of the Spears School of Business at Oklahoma State University. And Dr. Laura Ahlstrom, Assistant Professor at the Spears School of Business at Oklahoma State University. Thank you all so much for joining us here today. As a quick outline for the presentation, we will first hear from Wendy Doyle. She will provide a brief overview of the research project and United We. As the generous funders who made this research possible, we will hear from Mark and Dean Eastman, followed by Dr. Ahlstrom, the lead researcher for the Status of Women in Oklahoma report. And with that, I'm going to pass it over to Wendy.
Thank you, Stephanie. Thank you to our community partners who have joined us this morning, other supporters and members of the media. As Stephanie mentioned, I'm Wendy Doyle, President and CEO of United We. Today, we are so pleased to share in-depth research that we will use to help solve economic challenges faced by Oklahoma women. First, let me share some United We background. Our mission is to advance all women's economic and civic leadership to make meaningful change. We do this through a few initiatives, but I'd like to highlight specifically our evidence-based research and policy reform that positively impacts all women. Research is the first step to true sustainable change. It is critical to identify specific barriers to women's economic development, and then we must develop smart, practical solutions to overcome them. Through our work, we know too many women remain on the sidelines because they face unnecessary workforce development obstacles such as access to affordable childcare, limited family leave, entrepreneurship restrictions, pay inequality, and inadequate public policies. All of these issues disproportionately impact women, yet they are solvable. For more than 30 years, we've been making meaningful change across the Midwest and beyond. Today, I am so proud and pleased of United We to move our mission into Oklahoma. More than ever, we must unite to advance and support policies that strengthen Oklahoma women and families for the economic development of the state. Before we dive into the research, I'd like to personally thank the two funders who made this important research possible: the Ash Grove Charitable Foundation and the Spears School of Business at Oklahoma State University. We believe in the power of partnerships and collaborations at United We, and we sincerely appreciate the generosity of both organizations who are invested in transforming the futures of all Oklahoma women. First, I'd like to welcome Mark Meads, President of the Ash Grove Charitable Foundation. Mark, thank you so much for being with us this morning, and I'd like to turn it over to you.
Thank you, Wendy. It's a pleasure to be here today with all of you. Ash Grove Cement Company is one of the largest cement companies in the United States and has been in business for more than 140 years. In Oklahoma, we have coworkers, customers, and community members that we cherish and embrace. Ash Grove plays an important part in the foundation and infrastructure of our country, and this includes the advancement of women. At Ash Grove, talented people of all backgrounds are welcome. Everyone has a fair and equal opportunity, and our working environment and community environment supports people being themselves and performing at their best. Inclusion is getting everyone to achieve full participation and optimum performance. Diversity is not just about race. It's all how we are similar and all how we differ. For me, it's exciting to see the expansion of United We's mission to more communities. Ash Grove has been supporting their work since 2015. We are seeing the significant impact being made today, advancing women's economic and civic leadership to make meaningful change. The model of utilizing qualitative and quantitative research to identify barriers for women and then to find innovative solutions, it works. We are grateful to play a role in supporting United We's mission by funding the Status of Women in Oklahoma Research Project. For me personally, I know there's a role for all of us to play in this work. We are all responsible for recognizing the ways women are being held back and take action to correct it. When we all work together, so more women can participate in the economy, our families and communities they thrive. On behalf of Ash Grove, thank you for being here today. You are a big part of that first step to transform lives across Oklahoma. Wendy, I'll turn it back over to you.
Thank you so much, Mark, not just for being here today, but for your leadership, for being a longtime supporter of United We, and most importantly, for being a tremendous ally to all women. We really are grateful. Next, I'd like to introduce Dr. Ken Eastman, Dean of the Spears School of Business at Oklahoma State University. The power of this partnership is substantial, and the work made possible will go far beyond the report you see here today. Not only did the Spears School execute the research, they made it possible through generous funding. Dean Eastman, thank you and welcome.
Thank you, Wendy. As Wendy said, I am Ken Eastman, Dean of the Spears School of Business. Very delighted, as Mark said, to see all of you here virtually, and very pleased to be here and participating in this press conference with United We. The status of women in Oklahoma research is important to me personally, but also everyone here at Spears and Oklahoma State University, as it fits very well with our mission as a land-grant university. The research that Spears business faculty conduct on a daily basis is relevant, accessible, and beneficial. It could be the research of a management professor conducting on the disparity that exists among African-American women in executive roles, or a finance professor's research on investors' responses to the COVID-19 pandemic. Their research is impactful and timely. Dr. Laura Ahlstrom's research fits very well with our tradition and has serious and significant implications for the future of Oklahoma. Progress in this state is only going to take place if this research-based information is heard and addressed by all, which will help us to improve the lives of our citizens and the communities throughout Oklahoma. As the only Oklahoma institution partnering with United We thank you for this opportunity. We are very proud of our collaboration with you and looking forward to seeing how this research impacts everyone in the state of Oklahoma. We also hope that we get another opportunity to work with you again in the future. So thank you, Wendy, and thank you, United We, for this opportunity, and I look forward to hearing Laura's result. Thank you.
Thank you, Dean Eastman. We're grateful for your leadership and your collaboration. Next, Dr. Laura Ahlstrom will walk us through the key points of the Status of Women in Oklahoma report, which is benchmarking data in 5 major areas: employment and earnings, healthcare, childcare, poverty and social insurance, and civic engagement. Dr. Ahlstrom, I'll turn it over to you to share some general themes and specific barriers to women's full economic participation right here in Oklahoma. Dr. Ahlstrom.
Thank you, Wendy. As Wendy said, I am an assistant professor of economics at Oklahoma State University, and thank you for the opportunity to participate in this research. Women in Oklahoma face challenges economically and politically. A recent study that ranked the best and worst states for women in terms of equality found Oklahoma 51st out of the 50 states and Washington, D.C. The state had low rankings, both in terms of women's economic and social well-being, and in terms of women's healthcare and safety. Next slide, please. When looking at the data for this study, most of the data comes from publicly available sources. So a lot of it comes from the American Community Survey from the US Census Bureau, and we're looking at the years 2015 through 2019 primarily. Also, I have data from the Bureau of Labor Statistics, as well as data from Oklahoma State Department, including the Oklahoma Human Services annual reports. Next slide. Thank you. Looking at this slide shows us women's bachelor's degree fields, or excuse me, the percentage of adults 25 and over with a bachelor's degree by degree field. And we have Oklahoma males and females, and we also have males and females in the United States. And we see that compared to women in the United States overall, Oklahoma women earned larger percentages of degrees in science and engineering, or in education, and in science and engineering related fields. And a science and engineering related field is something like nursing, physical therapy, or architecture. Women in Oklahoma also earn smaller shares of degrees in science and engineering. So that's your more traditional natural physical sciences, social sciences, mathematics, computer science, and your engineering fields. And women in Oklahoma also earned a smaller proportion of degrees in business fields. Next slide, please. Thank you. This shows us the percentage of labor force participation rate by county in Oklahoma. And so we know that women's labor force participation and their level of education is connected to their earnings. And so what we see here is that in Oklahoma, the average labor force participation rate among women is about 56%, which is a little bit lower than the US average, which was 59%. We can see that the range of labor force participation rate is ranges from about a low of 42% to a high of 64%. And you can see that labor force participation is greater in some of the more metropolitan regions, and we have less labor force participation rate in the state in sort of that southeastern portion of the state. Next slide, please. Thank you. This slide looks at the median gender earnings gap for women in the United States and women in Oklahoma from 2015 through 2019. And during that time, women in Oklahoma earned an average of 74.5 cents for every dollar earned by men. And the US average over that 2015 to 2019 period was 80.8 cents. So women in the United States are earning a higher, have a lower gender earnings gap than women in Oklahoma. And if current trends continue, the estimates suggest that women will not receive gender earnings parity in Oklahoma until the year 2076. And this is particularly concerning because there's an increase in women who are breadwinners in the state. Among married women, 27% of white women, 19% of Black women, and 17% of Hispanic or Latino women who are married are the breadwinners in their family. And the number of female breadwinners is increasing. Also, approximately 6 in 10 of the minimum wage workers in the state are women. So this gender earnings gap is something that is concerning, and it seems to be, unfortunately, kind of getting worse. Next slide, please. This slide shows us the percentages of the adult population in Oklahoma who lack health insurance from 2015 through 2019. And we have the total Oklahoma, and then we also have males without insurance and females without insurance. And we see here that the percentage of women in Oklahoma without health insurance increased between 2015 and 2019. And in Oklahoma, the average for adults without health insurance is around 14%. In 2019, the US average for adults without health insurance was 9.2%. And Oklahoma had the second highest number of uninsured women in the United States in 2022. Next slide, please. Now we turn to looking at Medicaid enrollment, and this is Medicaid enrollment by gender in the United States and Oklahoma from 2015 through 2019. And we can see that during that time, fewer women and men in Oklahoma were enrolled in Medicaid compared to men and women in the United States. In terms of women specifically, between 2015 and 2019, 18 to 19% of women in Oklahoma were enrolled in Medicaid, relative to about 21% of women in the United States. In July of 2020, Oklahoma implemented Medicaid expansion, and it has been fairly successful in enrolling additional people in Medicaid in the state. Over 250,000 additional people, most of them children, have been enrolled in Medicaid since this time. And the state now has over 1.1 million total Medicaid enrollees, and that's an increase of 12% since 2013. Next slide, please. Thank you. Now turning to childcare. This slide shows us the number of licensed childcare facilities in Oklahoma from 2015 through 2021. And as you can see, during that time, there has been a sharp decline in the number of licensed childcare facilities in Oklahoma. In 2020, there was a pretty large decrease in the number of facilities due to many of them closing as a result of the COVID-19 pandemic. The state made efforts to help support childcare facilities in 2020 and 2021. And as a result, they were able to, the state was able to increase the number of licensed childcare facilities in 2021 by about 10%. But that's still fewer than the number of childcare facilities that were in the state in 2019. And a 2018 study found that roughly about 55% of Oklahomans live in what is known as a childcare desert. And that's an area where there are more than 50 children who would want the access to a childcare facility, but there are either no childcare facilities, or there are such a small number of childcare facilities that the number of children who would like the childcare slots is 3 to 1. So there are 3 times as many children who would want slots in a childcare facility as are able to actually have access to a childcare slot. And that was about 55% of Oklahomans do lack access to childcare facilities in their census tract. Next slide, please. The cost of childcare in Oklahoma is very expensive. The annual cost of childcare for an infant in 2020 was $8,940 or $745 a month. For 2 children, an infant and a child the age of 4, the 2020 annual cost was $15,702. As a cost of for the cost of childcare as a percentage of a family's income, for a married couple, approximately 11.7% of the income of their family income would go towards caring for an infant. If they have 2 children in childcare, it would take just under 21% of a married couple's income. For a single parent, the cost of childcare is even more expensive. For a typical single parent, the cost of an infant for infant childcare is about 40% of the typical single parent's income, and about 69.5% or just under 70% of a single parent's income to care for 2 children in childcare. The U.S. Department of Health and Human Services considers childcare affordable if it costs 7% or less of a family's income. So the costs of childcare in Oklahoma are much more expensive than that recommendation from the federal government. Also, the average cost of childcare in Oklahoma is more expensive than a year of in-state tuition at a 4-year public college. And the Oklahoma College Start estimates that the cost of tuition and fees in 2021-2022 at a regional public university for a full-time Oklahoma State resident was just over $8,000, so $8,044. So that is a little bit less than the cost of caring for an infant in 2020. Next slide, please. In looking at the number of childcare subsidies, So the state has in 2020 and 2021, the state increased its childcare subsidy, but the state is still behind many other states and the federally recommended reimbursement rate. And on this slide, we can see that the number of children who have received childcare subsidies in Oklahoma from 2015 to 2019 has decreased. The state directly subsidizes the childcare providers, and they reimburse the childcare providers. It's estimated for only about 60% of the true cost of providing care. And the federally recommended reimbursement rate is 75%. As a result, low-income families in Oklahoma may pay as much as 23% of the true cost of childcare for their children. The high cost of childcare also prevents many women in Oklahoma from returning to work after having a child, as survey research shows. Next slide, please. This slide shows poverty rates for women in Oklahoma, and among adults in Oklahoma ages 25 to 64, women in the state have higher poverty rates than men in the state, and also women in Oklahoma have higher poverty rates than women in the United States on average. This slide particularly shows the poverty rate for women ages 65 and over from 2015 through 2019. And we can see that the poverty rate for women in Oklahoma increased during that time, as well as the poverty rate for women in the United States. And also, Oklahoma has an aging population. So this increase in poverty rates among our people ages 65 and older, that is quite concerning with the state's aging population. Next slide, please. This slide looks at the percentage of women in poverty by county, and the county average in Oklahoma was just about 18%, so 18.4%. But we can see that the range of percentage of women in poverty ranges from a low of about 8.5% to, in some of the more metropolitan areas, to a high of about just under 30%. And we can see that the percentage of women in poverty is higher in that sort of southeastern portion of the state, where we also had lower labor force participation rates for women. Next slide, please. This slide shows the percentage of single parent households who are receiving public food assistance. So that is food assistance or SNAP, supplemental nutrition assistance benefits. And we can see that this slide shows the United States, Oklahoma, the Oklahoma City Metro, and the Tulsa Metro. And we can see that in every geographic region, over 1/3 of female-headed households receive food assistance compared to about 7 to 10% of male-headed households. There's also a higher share of male and female single householders in Oklahoma who receive food assistance compared to their peers in the United States. Next slide, please. Thank you. This slide looks at civic engagement and civic leadership in the state, and particularly the percentage of women in state legislatures. And we have an average for the United States and then the Oklahoma percentage. And this shows from 2015 through 2021. And women's representation in Oklahoma, in the Oklahoma State Legislature, declined slightly from 2015 through 2018, from about 14% to just under 13%. And in 2018, there were a record number of women who were elected to the Oklahoma State Legislature. In 2018, women won 23 of 101 seats in the Oklahoma House of Representatives, and women won 9 of the 48 seats in the Oklahoma Senate. However, as of 2021, women comprised just under 21% of the Oklahoma State Legislature, compared to about 31% of women in US state legislatures on average. Next slide, please. This slide shows voter turnout among men and women in the United States and in Oklahoma. And so this is the percentage of adults who voted in the elections from 2014 through 2020. And we can see that a larger percentage of women in Oklahoma voted compared to men in the state in every election. Also, we see that a smaller percentage of women in Oklahoma voted compared to women in the United States on average overall. And there was also a significant increase in voter turnout by women in between the 2016 and the 2020 presidential elections. There was an increase in women's voter turnout of about 5 percentage points. Next slide, please. Turning now to looking at the effects of the COVID-19 pandemic. So like many places in the United States, Oklahoma was hit fairly hard. And this slide shows the monthly unemployment rates in Oklahoma in 2020. And we can see that in April of 2020, there was a big increase in the unemployment rate from 3%, just about 3% in March to 12.6% in April. The monthly unemployment rate has been on the decline since April of 2020, and Oklahoma currently has one of the lowest state unemployment rates in the country. In looking at unemployment among women and men in the state during the second quarter of 2020, the unemployment rate for women in Oklahoma was 12%, which was about 4 percentage points higher than it was for men in the state in that second quarter of 2020. And this, the next slide, please. The next slide looks at monthly unemployment insurance claims by gender. So we have men and women. And this shows that in April of 2020, the number of monthly unemployment insurance claims was greater for women than men. And in June of 2020, the state had over 188,000 new unemployment insurance claims. That number declined, and by fall of 2021, the numbers of men and women filing for unemployment were closer to pre-pandemic levels. Next slide, please. So my final slide is just looking at some things that could be done in the state to possibly improve the status of women in Oklahoma. So I have just a few policy considerations. One thing that the state could do is increase the state minimum wage. So the state currently has $7.25 an hour, which is the same as the federal minimum wage. And the state minimum wage has not changed since the federal minimum wage changed in 2008. And many states in 2022 increased their state minimum wages, as well as many localities and cities increased their minimum wages. And so Oklahoma has not done so. And with approximately 60% of our minimum wage workers being women, an increase in the state minimum wage would be a real help and benefit to those women. Another policy considerations is the increase would be to increase the childcare subsidy reimbursement rate for providers. So as I said, our current reimbursement rate is about 60% of the true cost of providing care for the childcare providers. And the federally recommended rate is 75% reimbursement rate. So that's something that the state could do. The state did increase childcare subsidies during 2021, but they could still do more in increasing that childcare subsidy reimbursement rate for those providers. And that would go a long way to helping the providers. It would also go a long way to helping low-income Oklahomans have access to affordable childcare. Another possible policy consideration for the state would be to provide paid family leave. A number of states have started to implement state legislation. So I think it's 9 states so far have implemented a paid family leave policy. And that is something that Oklahoma could do because women, definitely survey research shows that women are not going back to work after having a child and because of the high cost of childcare. And so providing access to paid family leave would go a long way for benefiting women in Oklahoma. And thank you. I will turn it back over to Wendy.
Oh, thank you so much, Dr. Ahlstrom. That research overview was extremely insightful. And I would also like to thank the entire OSU team for your support of Dr. Ahlstrom on this, but being a part of this effort as well. And the women from rural and urban settings and across all socioeconomic levels are directly impacted by this research, which as you have seen today, is more than 50% of the Oklahoma population. At United we believe that it is our collective responsibility to take this research, identify innovative solutions, and work to impact lasting systemic change. Today, our work to identify funding and collaborative partners begins. It is our vision to implement the same model we have developed across the Midwest. In this model, research is really the first step, but none of our future efforts are possible without strong and forward-thinking partners. Together, we will educate policymakers, corporate and community leaders on this data and this important research study so they too can begin making change where it matters most. Most importantly, we will begin to identify strategic, nonpartisan policy priorities that impact all Oklahoma women, but it helps advance Oklahoma as a state economically. Now that this data is available to everyone, we are all responsible for the next steps. And for some of you, I have something you can do right after this call. If you are a woman in Oklahoma, I encourage you to learn more about our Appointments Project, which is a civic leadership development program. Unlike any other program in the nation, the Appointments Project facilitates the appointment of women to civic boards and commissions at the city, county, and state level. An intervention that will address what Dr. Ulstrom covered under the representation in the State House. It is destroying the outdated assumption that women are not qualified, available, or interested in civic service. And we know in order to make effective change, representation matters. We are hosting a webinar about the Appointments Project for Women in Oklahoma City later today and again on May 24th. With that, I will turn it back to Stephanie Morello.
Thank you, Wendy, and thank you, Dr. Ulstrom, so much for all of that great information. Here in a minute, we will have a slide that has the URL to view the report. Angie has also already added it into the chat, so you are welcome to view the report. And at this point, we're going to go ahead and open it up for questions. So again, feel free to send your question in the chat box. You are also welcome to unmute and ask your question verbally. But we are already actually have a couple of questions, so I am going to kick us off. Wendy, this first question is for you. What do you see as the biggest need facing Oklahoma women today? And are there any trends that align with other research throughout the region?
Well, there are a few things that really surfaced. One, the real shocking statistic about the inequity in pay and how many years it's going to take to really get equality between women and men. Oklahoma is a little bit less than what we've seen in some of the Midwest, with about 75 cents to the dollar that men make. And so what we really like to see is some, really progression with shoring that up. I think, something else that really jumped out, and we saw several things posted in the chat, is the Childcare challenge. Women were significantly impacted, as we all know, during the pandemic, with schools being shut down, with childcare facilities. But what we've identified, through our work and just conversations across the Midwest and nationally, is that childcare industry was already a challenged and stressed industry prior to the pandemic. Just from the, supply and the demand side, we're seeing, with Oklahoma, significant gaps there. So, I saw in the chat, someone, drives about 100 miles to be able to access, good quality childcare. This is not uncommon. So this is really something that we see that is leaning in and an epidemic with Oklahoma families, but just, across the Midwest and nationally. So we really want to pay attention to the childcare. And as an organization, we have really prioritized this and hope to be able to do some work around this in Oklahoma. I think, a couple of other things that are important to us, United We, is looking at the occupational licensing gap in the barriers for women. So women hold a professional license for their occupation, typically 3 times the rate that men do. So this is something that we really want to bring a practice to Oklahoma, look at reducing barriers, not only for those in the workplace, but for women entrepreneurship as well. And then finally, a key theme that Dr. Ahlstrom identified as a policy priority that could really help with some of these, issues that have been identified is a paid family leave policy. In the state of Oklahoma, we'd love to see companies, take the initiative on their own to implement, a paid family leave policy. But we would, like to, administratively and perhaps legislative move that conversation forward as well.
Great. Thank you, Wendy. I have one more follow-up question on childcare here, and then a couple nuanced questions related to research for Dr. Ahlstrom. The follow-up on childcare is, how can we, as just individuals, assist parents with this issue? Do we work with churches or the YMCA types of groups? Any thoughts or guidance there? Wendy, I think that question was for you.
Oh, I'm sorry. I'm sorry. I thought you said Dr. Ahlstrom. On the childcare, opportunity, and we're going to, position this as an opportunity versus a challenge. There are lots of opportunities, but what we really need is, you saw significant closure during the pandemic, and that's really put additional stress on the supply side of childcare and for families. So accessibility is starting to wane a little bit. So what we really need as, a strategy is to, encourage childcare facilities to reopen, which are primarily led and are a woman-owned business, primarily with women in that workforce providing that service, and women of color as that workforce development. So what we really need to do is start having the conversation about what it's going to take to reduce perhaps some regulations, some licensing requirement barriers, to start to open it up so it's not so challenging for families. So again, certainly the YMCA, churches are doing their part, but they're also maxed. And we've heard time and time again that there are significant waiting lists for families. So again, that puts families in a position to have to choose between work and childcare. And we really need to take that barrier off the table so we can get people back to work, both women and men. So I think there's a lot of things that we can do, but the most important takeaway from today is keep that in the conversation. So we can keep the issue on the table, and that's where we can come up with some innovative and creative solutions for Oklahoma.
Thank you very much, Wendy. Dr. Ahlstrom, this question is for you. With the slides about women without health insurance, is there any data about uninsured? I feel like being uninsured doesn't necessarily mean there's access to healthcare. Are you able to address that for us?
So I didn't specifically look at access to healthcare facilities or hospitals. I did look at the number of women who are uninsured, but not necessarily the number of people who in the state who are underinsured or wouldn't have access to healthcare. But that is something that would definitely be good to look at. Thank you for mentioning that.
Great, thank you. And thank you for underinsured. I think I said uninsured again. Okay, another question for you, Dr. Ahlstrom. Were you able to break down the data presented today by ethnicity? If the data is dismissal for women in general, I cannot imagine what it looks like for women of color.
I didn't do much of that. I did look at ethnicity and race in terms of the gender earnings gap, and the gender earnings gap for women of minority backgrounds is worse than the gender earnings gap for white women in the state. But I really didn't focus too much on race and ethnicity. I was really focusing on the gender comparisons mostly.
And I would just like to add there, Stephanie, too, that, I know Dr. Ahlstrom, we talked significantly about this too. And, data collection within where we have access to some of this public information is simply not collected. So, if there is one thing in the, government, what public research information collected could do better is collecting that information. So, in some examples, the information simply wasn't available. And so we can do better. And we would like to see, government step up and do a better job of collecting gender and ethnicity background information.
Great, thank you. One more for you, Dr. Ahlstrom. As you compiled the research findings, what personally resonated or surprised you?
I was really surprised by the gender earnings gap. I knew that there was a gender earnings gap in the United States, but I was surprised at how much larger the gender earnings gap is in Oklahoma compared to women in the United States. And also I was really surprised at the childcare affordability statistics. I really wasn't, I had no idea that, that it would cost approximately 70% of a single parent's income to have 2 children in childcare. And I think that that's something that really resonated with me. And I think that's something that the state can do better with.
Thank you. Okay, let's see. I think we might have a couple more questions. Oh, this is a great question. Wendy, I believe this is for you. So in other states where you've compiled these types of reports, what have been some of the most successful outcomes once more people were aware of the data? And I think, that childcare piece and paid family leave is certainly something to touch on, of course.
Absolutely. And, what really is, just incredible about a research report like this is that, it's a truth teller. And to be able to sit down and have a conversation with a corporate leader or a policymaker, it's data and facts that are on the paper. And that really informs a constructive and positive conversation about, here are the barriers. Now let's get to work on the solutions. So what we have really seen is that an investment in a research study like this has, about a 3 to 5 year shelf life. And, it is all of our collective responsibility joining us today to keep this information out into the public and just inform, intelligent conversations. So, first and foremost, it's a truth teller. And then, we will be getting to work as an organization, United We, to start to have those, educated and informed conversations with policymakers and looking at, small things that the state can do that can be big wins, moving the economic development and advancement of the state forward. And, I mentioned occupational licensing is, a priority for us as an organization. That could be a 20-year project that we would work on, because there are so many occupations that have oversight. So, reducing a barrier for a hair braider, for example, in the state of Oklahoma could mean, significant dollars back into that, family's household budget, and to be able to then be used for childcare. So, that's an example of how a strategy can be put together as a result of this research. Certainly, we'll be using this definitely in the childcare space because we know we need to get Oklahoma women and men back to work. The pandemic just, really pulled significant individuals out of the workforce, as you saw by Dr. Ahlstrom, reporting that unemployment claims. We're starting to see people get back to work, but it's those lower income positions that aren't, opening back up. And, it's significant. It could be a significant impact for the economic advancement for Oklahoma.
Thank you, Wendy. Would you mind sharing a little bit about the success with the paid leave in Kansas that was influenced by a similar study with Governor Collier and then Governor Kelly?
Absolutely. So again, to really get some legislative traction on a paid family leave, initiative can take significant resources to be able to move that forward. However, there are some administrative actions that can be taken, and we have been successful as an organization implementing that both in Kansas and Missouri by having conversations with the governor. And then the governors in both examples have issued executive orders for state employees to be able to have a paid family leave. In Kansas, as an example, we started with Governor Collier. It was a 6 weeks paid family leave policy, the birth or adoption of a child for primary and secondary caregiver or secondary caregivers, which means if a husband and wife or partners work together in the state government, they could still both have access to that great benefit. Governor Kelly came back, really took that model, added last summer an additional 2 weeks. So now it's 8 weeks. And it also includes foster care. We were successful in sharing that policy with both the judiciary as well as the legislative branch and the Kansas Board of Regents, which oversees all of the colleges and universities in the state of Kansas. And in Missouri, the governor also implemented an 8-week paid family leave policy that was implemented also legislative branch and judiciary. So some administrative actions and conversations that we can have that signals to Oklahoma corporate private sector, you can do it too, and something that we will be taking the initiative to move forward.
Wonderful. Thank you so much for sharing that. I think this could be a question for either of you. In what states and region are women doing well? Why are they doing better? Are the metrics we looked at here today standard indicators across the country? Dr. Ahlstrom, if you want to start.
So that's a good question. I specifically was looking at Oklahoma, and a little bit of my research took me to looking at Oklahoma in comparison to rankings for women in other states. I mentioned at the start the 2022 study that ranked the best and worst states for women. So I don't have a lot of information about other states, but that might be a place to start. It was 2022 Wallet Hub, and it was looking at the best and worst states for women's equality. But I think that the metrics that we're using, the gender earnings gap, looking at childcare affordability, and looking at poverty rates, I think that these are standard metrics. I know that I tried to follow the work that was done with United We, with previous researchers in Kansas and Missouri. And so I think that these are pretty common metrics. And so, I would just I'd point you maybe to that Wallet Hub study if you're interested in looking at more about comparing women across states.
I would just add, Stephanie, as Dr. Ahlstrom presented today, we see, and it's across the country, more positive momentum for women in metropolitan communities than in rural. And that's been pretty standard in the Midwest. So, most of the statistics that Dr. Ahlstrom presented, demonstrated that.
Great. Well, thank you guys so much for all of your questions. The full status of women in Oklahoma report is available on our website. There is a link right here. I would like to conclude by thanking each of you in participating in today's call. In addition, sincerely thank you to the Spears School of Business at Oklahoma State University, the Ash Grove Charitable Foundation, and all others who helped make this study possible. A big thank you to Mark Meads, Dean Eastman, and Dr. Ahlstrom for joining us on this call today. If you have if you're looking for any more information about United We, please visit our website at united-we.org. With that, we will conclude our conversation today, and thank you so much for joining us.